Shall we start now, ma'am?
Yes, ma'am.
Hello, everyone present here virtually. I am Nita here, and I welcome you all for today's session, which title as a importance of early intervention in development delay. And presenting this session, we have with us our today's expert, Dr. K.C. Gayatri. PhD is currently working as an assistant professor in Chettinad School of Physiotherapy, Chettinad Academy of Research and Education Care, Chennai. She have 8 years of teaching experience and 10 years of clinical experience in a pedigree. Complete UG and PG from the Tamil Nadu, Dr. MGR Medical University. Published 3 articles and chapter in the book, received 1 copyright, received 2 USA patent certificate, 1 Indian patent certificate based academician award in 2013. 2013. Interested in a pedigree and passion in teaching. Without wasting much time, I am welcome to Miss Dr. K.C. Gayatri. You may start now, ma'am.
Yes, ma'am. Thank you. Thank you for your wonderful introduction. I like to introduce, already you have gone through my introduction. Today, my topic is I'm going to present an importance of early intervention in developmental delay. And these are the objectives. These are the objectives we are going to discuss in this hour. First, we are going to discuss about describes the developmental delay and describe what are the different types of developmental delays we have. Describe the meaning and significance of the early identification. Discuss the strategy for the early identification and explain the concepts and significance of the early interventions. Identify what are the strategies we have for the early interventions. Now we can go on with the development. First, we want to clarify about what is meant by development. Development, that's a different thing, which is different from the growth. Growth, which is means the increase in the size and the length of that will comes on the growth. Then what is meant by development? Both are same? No, it's not like that. Development refers to the continuous process in the lifetime of the people. Development depends on the genetics, hereditary, and the environmental factor. Child developments refer to how your child grows and changes over time. That means during the lifetime of your old age, the development will be in that. Every years of the development depends on the genetical factors, hereditary factors, and the environmental factors. And this are the can you see this are the factors which resembles of this biological risk factors. If this are the factors depends upon the development of a baby. Each individual it may differs, but in the biological factors, the birth in the preterm birth and the birth complications in the intrauterine factor. That means the baby in the uterus, if they have any maternal nutrition deficiency or maternal infectious, maternal substance usage, any substance the mother has been induced, and the intrauterine growth restrictions, that is the IUGR babies can have any defects. And in the child nutrition factors, suboptimal breastfeedings, protein caloric malnutrition, micronutrition deficiency. If the baby is having any deficiency in this type of nutrition, it can also causes to the developmental delay. In the childhood infectious, in the infectious conditions, if the baby is having any type of from the motherhood, if the child is having of HIV infectious, malaria, and the chronic diarrhea, parasitic infections, if they have any type of this infection, it can also leads to the developmental delay. Next, we can go on with the contratextual risk factors. What are the factors which can lead to the developmental delay? In this, we can go on with the parents. In this parent type, we want to go with the depressions and the ill health, low education, high levels of stress. If the parent is not having about the knowledge regarding the early interventions, and if the parents undergo so much of stress that hormones can affect the babies in the uterus, that it can leads to the one of the cause of this. And as the child condition, intensive or the non-responsive care given to the child maltreatment, including physical punishments, being orphanage or refuse status. If the parents is refusing the student, the kids, if the kids is not having proper attention from their parents, it will also can leads to that. Next is the family. In the family, if the child is not receiving adequate opportunities for learnings from the home, if they are not allowing the baby to explore themselves, it can also cause leads to the developmental delay. Crowded or highly chaotic home environmental, some things the baby is not having more attention to them, it is also one of the cause of that. Community is same. Community is also one of the factors, and it is the main factor which is for the early care environment, which is giving so much of attention. It will give a nice result. If it is not giving that, it can also lead to that. And then one is the environmental factor. What is meant by environment? It is depends upon the both combinations of the birth and the parents. Between the biological factors and the both factors, the environment is very important for this. Next is the developmental delay. We can see development, and what is meant by developmental delay? Delay means the word itself, it will resembles, which is not coming to that point. That is the developmental delay. Delay in development occurs when the child fails to attain developmental milestones as compared to the peers from the same population. That means if you are comparing any one, you want to compare with the peer groups. If we are comparing that, if the baby is not attaining that type of milestones developments, we can tell it as the developmental delay. It can caused by the impairment of the It is caused by the impairment in any of the following distinct domains such as gross motor, fine motor, speech and language, cognitive and performance, social, psychological, sexual and activities of the daily living. So in these factors, we want to concentrate on the development can vary in different factors like the fine motor development, speech development, languages development. What are the domains the baby is having ADL activities? If they are having lag in that, when compared to their peer groups, it will, we can tell it as the developmental delay. We want to identify that performance equal or greater than 2 standard deviations below the mean on age appropriate standardized norm reference testing. Next, we can classify the developmental delay in the 3 classifications. First is the isolated developmental delay. Isolated, in the word itself, it will remind you that if the baby has been isolated themselves from one point of view to another point. That is in the domains, gross motor, fine motor, cognitive, language, social language. In this 5 domains, if the baby is isolating himself from any one of the domains, that will come under as the isolated developmental delay. Second is the multiple developmental delay. What is meant by multiple developmental delay? It's more than 2 or 3 development domains which the baby is having any abnormalities. That will come on the multiple developmental delay. Third is the global development delay. In the word itself, it will resemble that global. Global means it's a whole of that. That is more than 4 or 5 members, it will comes under the global developmental delay. That is the significant delay the baby can note it in the most of the developmental domains. Now, these are the causes, genetical causes, environmental causes. If the baby is in premature birth, that is the baby is not up to the gestational ages, that baby is known as the premature birth. Brain injury, that is at the time of the birth, if the baby is having any injury, that will comes on the brain injury. If the baby is having hypoxic ischemic encephalitis, HIE grade 3 or something else, it can also lead to the developmental delay. Then factors like the prenatal factors and the perinatal factors, postnatal factors. What is meant by prenatal factors? In this prenatal, that means the before delivery. That is in this month, the prenatal factors which can also lead to the developmental delayed babies. Perinatal, that is the at time of the birth, if the baby is undergone any complication, it can lead to that. Then postnatal factors. What is meant by postnatal? Post means it's after the birth. Natal is the newborn, it will come. So postnatal factors, after delivery, if the baby is undergone any other complication, it will comes on the postnatal factor. Next is the metabolic disorder. If the baby is undergone any metabolic disorders, it can also leads to the developmental delay. Genetic factors. What is meant by genetic? Genetical factors due to any chromosomal abnormalities. If the baby is having any more 23 pairs of chromosome, in that if the baby is having any abnormality in that. If the baby is having 21 trisomy, instead of 21st two chromosomes, the baby will have addition of that. That will comes under on the 21st trisomy or Down syndrome babies and the fragile X syndrome babies. This is also due to the chromosomal abnormality, which the baby is having short tail or long tail, shown like that chromosomal abnormality it will have. Second is the environmental factor. In this factors, you can see if the baby is, if the mother is exploring to that chemical substance like the mercury or lead during the pregnancy or after birth in the early stage. If the mother is having exposures to the mercury or lead exposing area, or after birth within the neonatal age, that is the from birth to the 21 days, if the baby is exploring more in that environment, that baby is also having chances to get the developmental delay. Next is the premature baby. As we discussed earlier, babies born before the gestational age. Usually it will comes on the 40 weeks, but it will depends on the mothers and the babies. Some baby is born before the 38 weeks, 36 weeks. If the baby is born before 36 weeks, they will comes around the preterm babies. From the 37 to 38 weeks, the baby will comes under the early term babies. If the baby is born after 38 weeks, they will comes under the term babies. After 40 weeks, the babies are the postnatal babies. Next is we can go with the prenatal causes. According to the causes of this, because prenatal causes, 32.7% of the babies will have developmental delays due to the genetical abnormality itself. And the 7.7% of the people will having chances to get the developmental delay because of the chromosomal abnormalities. That is before delivery, if the baby is having. If in the genetical factors means the mothers or any family member is affected this without having the karyotyping knowledge, if they got conceived, they are having chances to give the developmental delayed babies due to this. Next, in the perinatal causes. In the perinatal causes, that is the during delivery, most of the babies are having, that is more than 26.7%. 1/4 of the babies are affecting during the perinatal at time of the birth. If the baby is, the first cry is very important. That time the baby is receiving the oxygen supply for that. If that time the baby is not having enough oxygen supply, it will lead to the hypoxic ischemic encephalitis. And most probably it will comes around 34.6% of the population is affected during this perinatal causes. And the postnatal causes, it was only 3.8%. 3.8%, that too, if the baby is exploring any of the chemicals or secondary causes from the mother, if it is generated, it can lead to this. Next, prevalence. Global developmental delay. It's an umbrella term when the baby is delayed for more than 1 or 2 milestones, which is defined as the global developmental delay. In the overall global developmental delay, it will ranges between 1 to 3%. In India itself, it has been growing from 3 to 13% within a year. So we want to concentrate on the most of the people who are not having aware of the developmental delay. They are all having, after getting the baby is having any problem, they are coming for the treatment. But early intervention mostly concentrate on the 0 to 3 years. Next, depends upon the domains. The babies are mostly for the cognitive development domains. They have 1 to 1.5% of the people affected due to this. In the learning disabilities, 8% of the people are affected due to the learning disabilities. 2% to 19% of the people were affected only in the speech and language domains itself. In this, the baby is not exploring themselves. Only the parents is giving so much of attention to them, having of only kids or anything else. The baby is not allowing to speak anything. So they are not having the aware of this. And any delay, any one of the domains, if the baby is having delay, it will comes around 15% of this. Next, we can go on with the neonatal assessment. What is meant by neonatal assessment? As soon as the baby born, we want to check. These are the important signs we want to go on with it. First is the APGAR score, which is very important for the baby's growth and development. Second is the birth cry. How with the baby's birth cry is depends upon. Next is the Heinz scale. That is the Hammersmith Infant Neurological Examination Scale. Next is the CDC angles. How much of the angles present in the. Next is the primitive reflexes. If the baby is having any of the lagging in this scores in this assessment, we can judge the baby is can have the chances to get the developmental delay or CP or Down syndrome, depends on this. Then what is meant by APGAR score? In this only we can see the explanation of this. A means appearance, P means pulses, G is the grammatis, A is the activity, and R is the respiration. We want to scores of the, if the baby is active, if the baby is appearing pink color, the baby's pulse rate is more than 100. The baby's cries and is normal to that. And the baby is having normal, strong cry. We can score it as 2. The baby want to score 10 out of 10 within a minute. The APGAR score is maintained, measured at the time of birth. Or if the baby is having any problem in that, after a minute, it will assess, and after 5 minutes, it has been assessed. If the baby is scored below age, it indicates the baby needs to for another assessment. If the baby is not having proper cry or the baby is not active, if the baby legs are very weak, it will also depends on the how the baby is experiencing. If the baby extremities, that is the hands and legs, or it's not in the pinkish color, if the extremities are in the blue, if the baby's pulse rate, heart rate which is less than 100 points, and the baby is in the weak cry, the baby is not crying normally, it's having weak cry, any meconium or fluids, amniotic fluid or any fluids can occupied in the nasal and the oral cavity. So we want to take care of that. If the baby is not crying, means the baby respiratory is not yet worked properly. So we want to go on that. If the baby is within this stage, we can score on with the 1. If the baby looks like very pale or blue, if the baby is not in the pink color, it will scores of 0 degree. And if the baby is not having any pulses also, it will score 0. The response, if you are giving any stimulation, any pinching stimulation or tapping stimulation or any tactile stimulation, if the baby is not responding to that, it will comes under the scoring of 0. If the baby is not responding and the baby is not giving any movement, if you are pinching the baby also, the baby will want to show the withdrawal responses. If the baby is not giving to that and the baby is not having any breathing, it will come under the 0. If the baby is scoring less than 5 out of 10, it's very dangerous. We want to go on with the respiratory ventilation, neonatal ventilators. Next, these are the primitive reflexes. It's very important that if the so many reflexes present in that, in this Moro reflexes, rooting reflexes, Palmar grasp reflexes, ATNR, these are the reflexes the baby want to be present at the time of the birth. but it should be disappears at the month of, if we are taking for a Moro reflex, if the Moro reflex should be disappears at the month of 2 to 4 years. If it is not disappeared, if it intact with it, it will the representation of the baby is having some neurological deficit in that. The baby can have chances to have any neurological problem to that. According to the rooting reflex also, the baby will have at the time of birth, and it would be disappear at 3 to 4 months. If it's not there, the baby will have the and any tongue tight or the poor eating, speech will not be there. So speech difficulties will also be present due to the rooting reflex. So at the month of fourth, it should be disappear. Palm or grasp reflex, that is the fingers grasping. If the baby want to have proper grasping, flexion, grasping and releasing of the object. If it's not there, the baby can't able to hold the pencil or pen. The baby will not have proper coordination in the handwriting. The baby will have poor writing skills. The baby will not able to have the proprioceptive sensory system also. And then we can go on with the ATNR. In this ATNR, asymmetrical tonic neck reflexes. That is that the baby want to be have proper eye coordination in this. If the baby is turns head to the one side, which side the baby head is turning, that side the hand should be in the extended. It should not be flexed. If it is flexed, it will come under the different. If the baby is, it should be appears at the time of birth. It should appear, disappears at the month of 6th month. If the baby is not disappears, the baby will have chances to get the decreased hand-eye coordination. If the hand-eye coordination is very important for this. If the baby want to look anything else, or the baby will know only the textures, the baby can identify the things before the 1 year. The baby can't express it. By touching that only, the baby will able to say that. So it's very important for the ATNR reflexes. Next is the spinal Gallant reflex. It also starts at the month of the birth, but it should disappears at the 9th month. If the baby is not having it, the baby will have the postural issues like the scoliosis and the misaligned or rotated pelvics, or the baby will have the pain in the lower back and the bedwetting after the potty training, hyperactivity, attentions and the concentration issues also the baby will have. Decrease lower body concentrations, lower body coordinations, pain and the tensions in the leg. The baby will have problem in the walking also, we can be able to see that. Next is the tonic labyrinthine reflex. That is the TLR. It should be formed within the uterus, the baby in the uterus, and it should be disappears by the age of 3.5 years. If the baby is not disappeared by the 3.5 years, it is withstand within the baby. It will represent by the decreased balance, and the baby will have the difficulties like the toe walking, hypermobility of the joints, and the weak muscles, weak posture, and the motion sickness. The baby can't able to, if the baby is flying or in the baby is having any bike ride or any riders also, the baby will have the motion sickness. The baby can't able to maintain the balance in that. The baby will feel difficult in climbing the stairs also. Atypical head position also will be there for this baby. Next is the Landau reflex. In this, the baby will start by the month of 4th to 5th month, but it should disappear in the first year. If the baby is not disappears in this, it will also leads to the poor posture and the muscle tone. Then if the baby is not having proper posture and the muscle tone, it will leads to the poor coordinations for the activities, which is very required for the upper body and the lower body movements, and it will lead to the delayed motor development. Next is the STNR, that is the symmetrical tonic neck reflexes. It will start by the month of 6th to 9th month, and it will disappear at the 9th to 11th months. That is, if it is started by the 6th, it will disappear at the 9th month. It's important in the standing balance and the postural. It for the walking also, it will, if it is not disappear, it will result in the W sitting of position of the baby and the poor hand-eye coordination, airplane walks. It will also because of this. Next, we can go on with the developmental milestones. Developmental milestones are the behavior that marks stages of the typical growth. For the each individual, it will differs from the children's all the developments at their own phases. These are the four developments we have: physical development, cognitive development, language development, and the socio-economic development. Physical development. What is meant by physical development? Physical development, which refers to the strength and the physical skills. The baby want to have walking or anything else, motor development. It will takes of the two developments, that is the gross motor developments and the fine motor development. This both will comes under the physical development. Cognitive development involves thinking and problem solving. If the baby is having in to reach any toys, if the baby want to have anything to have in the mouth, or the baby want to have the feed, the baby want to know that by the rooting reflex, the baby want to go to the mothers to have the feed. This is the recognition of the, this is the person which fill our tummy. If we are feeling hungry, they will not ask for the hungry tummy feeling to anyone else. By the recognition, the baby will do that. Next is the language development. Language development refers to the communication and understand. If the baby wants to give you any attention, the baby will produce the voice in that. Different ages, the baby will produce sounds to communicate with you, and what are the things they need, they will satisfy because with this language skills. Next is the socio-economic development. This is the socio-economic development of how the baby is interacting with the society and how emotionally attached with the society. With this depends on the socio-economic development. Next is here, this is the normal milestones. Normal milestone for the every years. Every month. For the first month, third month, seventh month, 15th month, and the 24th month, that is the 2 years. The baby's physical development is mainly depends upon till 2 years. What is the first month? The baby will be very small. The baby won't have proper developments in that. But in that, the baby, how the baby is responses to you. If the baby able to turns to the both the side by having the familiar sounds. If you are producing any sound, the baby can able to turn that side. It will comes on your motor, gross motor development. If you are touching, if you are giving any bangles, or if you are producing any sound, the baby can able to turn the head to that side. The baby can able to hear that. This will comes on your cognitive development. The baby can able to bring his or hands within the mouth or within the eyes. Try to, the baby will have so much of grasping reflex in that month. If the baby is not having proper grasping, the baby is having so much of stretched out hands, it will also resembles of the weak fine motor responses. Next, we can go on with the third month. In this third month, we can notice the hands of the 2 months. The baby's hand should be little bit of opening. It should not be so much of close. If it is so much of close, still grasping reflexes is present there. Next, smiles at the sound of the familiar voices. If the parent or caretaker or any family members producing any sound, the baby will give attention to them. The eye-to-eye context will be there and give the social smile. It will comes on the cognitive development. Following, if you are turning any object, the baby want to give the eye contact and the turning of the eyes from side to side and up and down. It will resembles of the cognitive developments. And support heads when on the stomach by the third month. If you are placing the baby on the tummy position, the baby is in the stomach position, the baby can able to lift the hand, lift the head till the 40 degrees. Next, we can go on with the attempt to imitate of any activities. If you are producing any sounds, the baby will able to produce that. It will gives you the nice smiles in this month. Next, we can go on with the 7th month. In the 7th month, the baby will achieve the gross motor development. That is the whole month, whole muscles. த்ரீயாவது கிளம்புறது. That's all. Seventh month, we can go on with the supports weights on the legs and the blabbers by the 3 to 4 months baby. It can able to show the, if you're asking anything else, it will show like that. In the 15th month, that is the 1.5 years, 1 year, 3 months baby, the baby can able to set up without support and the baby can crawls and the baby responded no. If you ask anything else, it will shows you no. The baby can able to fulfill his needs by the simple gestures by showing of that. I don't want like that. And it will start to chase the two vowel sounds like the blabbering of that. Tries to imitate words. If you are telling anything else, the baby will try to imitate them. Next is the 15 to 24 months. In this, the baby will comes to say single words. From the blabbering of the two words, it will comes to that. Next is the baby can able to phrase 2 or 3 words. Then the baby want to be walk alone. This is the important gross motor development. Next, looks at the object when told to look. If you are asking where is the fan, the baby can able to point out the things. It will comes on that. By the end of the 2 years, the baby begins to run. It will comes on the gross motor development and walks up and down, starts holding on the supports. If the baby is can able to do this by the second year, the baby is so normal. Recognition of the name. If you are calling the baby want to recognize this is my name. This is the important for the baby for the cognitive development. Follow simple instruction. That is the come here. Give it to your friend. Share this to your mother. Like that. If you are telling the baby can able to follow a simple instructions, it can able to see that. Next is here. How was the babies? Next we can go on with the abnormal. Next, gross motor development. What is meant by gross motor? So now, till now, we can see gross motor, fine motor, language. Then what is the gross motor? Just it's a clarifications for you. Gross motor development is one of the domain in the development. It is a larger group of muscle. Gross means it's a group of muscles which involved in performing a movements of muscles. Gross motor skill development involves a large muscles in the arms, legs, and the torso. That is the foot. Gross motor activities are important to everyday physical activities like walking, running, throwing, lifting. That is the way we will achieve of the all the group muscles activities. Next is the gross motor abilities. Also from the basis for the fine motor skills and related to the body awareness, reaction, speed, balance, and the strength. Can you see in this picture the baby, how the baby can able to grasp that? It is the stretching of the whole hand. In this, the baby want to extend full extension of the elbows and the partial flexions of the shoulder joint, extension of the wrist joint and the fingers extension to grasp the toys. This is the gross motor functions. That is the group muscles, how it has been activated. Next is the fine motor. What is meant of fine motor? In the word itself, it will give you a fine structures. Fine motor skill includes reaching, grasping, and manipulating object. Manipulating means it is transferring from one hand to the another hand. Fine motor skills also involve vision. Specifically, visual motor skills refer to the hand-eye coordination. That is, if your babies can able to see that, it will comes to that. If you, by touching the things and by the hand to bring to the mouth, it is the hand-eye coordinations. And can you see this? This is the fine motor. In this, can you see this? How the baby is very interested by using of the fingers, pulp of the fingers, the baby can able to touch and see that. By the touching, the baby is able to recognize the textures of that. That will come on your fine motor development. Next is your language skills. In this language skill, speech means making the sounds that makes words. Speech issues includes difficulties in the pronunciation of the sounds. That's the articulation, slattering, or the physical problems with a child's mouth that interferes with the talking and eating. If the baby is having any oral activities, oral cord abnormalities, the baby will have articulation problem. If the articulation problem is there, the baby will not able to pronounce it properly. If the baby is not pronouncing properly, the baby will have any speech issues in that. Next is the languages, means using of the words. How the baby wants to express their needs or any idea. How the baby want to fulfill their needs. That will all comes on the language. Next is the social development. In this social development, it will comes on the sensory development. That is the vision, hearing, touch, taste, and the smell. Social skills refer to our interactions with other peoples. This is the social development. You can see how the baby is interacting with the others. It's not for the parents, for any members, how the baby is interacting, that will comes on the. Next, identification process include. What are the things we want to do on in the identification? In this, screening is very important first thing. Second is the examination for the presence of any risk identity and protective factors. And third is the systematic observation. Systematic observation means systematically within the periodic times how it has been there. Next is the comprehensive evaluation, how it has been evaluated. That will also very important in identification. Next, these are the strategy for the yearly identifications. And DDST, that is the Denver Developmental Screening Test, which is one of the screening tests, which will give you the how the baby can able to identify. Next is the TDST, that is the Trivandrum Developmental Screening Chart. It is the mostly they are all used for the Indian population. In every vaccination card itself, it has been printed, so it is user friendly. We can the government in the government and in the public health centers also they are using this for the. And next is the Bailey scale of the infant and the toddler's development. It is a qualitative analysis of the baby. How the baby is. It is in numbers. It will gives you the how much of the babies have been affected, how long the babies need that. Like that, it has been. We can go on with the Bailey scale of the infant and the dog. Next, this are the red flag sign. What does mean by red flag? Means if the baby is having any abnormalities, if the baby is not crossing this, it will comes under the red flag sign. If the baby till 5 months, if the baby is not smiling at you, if the baby is not responding to the louder voice, if the baby is not bringing hands to the mouth, you want to check for the baby's neck muscles and in the baby's eye coordinations, you want to go on with that. Next, till the 6 months, if the baby is not experiencing any warm feel, does not want to cuddle. If you are taking the baby too close to you, the baby will don't like that. The baby hesitate by the cuddle, you want to go on with that. If the child is not having keeping eye-to-eye contact, eye-to-eye contact is very important for the cognitive development. That is the important thing to express to learn anything else. If the baby is not having eye-to-eye contact, you want to take care for that. The child isn't smiling. If you are making any louder voice, if you are giving different sounds also, if the baby is not responding to that, it will come under the development delay. Doesn't follow the object visually. If you are tracking, any visual tracking is done, if it is not responding, it will come on that. By the 9th month also doesn't respond to the sounds or gestures, doesn't respond to the own names or to the familiar voices. The baby doesn't give attention to the noise making also, you want to go on them. That is the 12th months if they're still responding to their name. This is very important. If the baby doesn't recognize their name by his first birthday, we want to take care of the baby. The baby's brain development will start by recognitions of their name. And the baby is not blabbering. If the baby it's very quiet, or the baby is producing 1 or 2 bisyllable words, by the 12th month also, we want to check the oral activities and the language development. If the baby is not reaching any toys, doesn't reach out to pick up any toys also, we want to check for them. Next is the 15 to 24 months, the baby isn't talking properly. The baby is not saying any small words. The baby is not interested to mingle with the peer groups. We want to check for this. By the 2 years, the baby is not able to make any two-word phrases. The baby is not. The baby is not mingling with the peer group mingles. They have the affect. Next is the yearly identification. In the word itself, it's yearly. The yearly identification, how yearly your identification, it's help for the yearly intervention and it will result in the recovery sooner. So yearly identification of the children's developmental delay or learning difficulties help us to understand and take the required steps to support the children and ensure their optimum development and learning. The yearly identification facilitates the use of intervention strategies to provide the required positive yearly experience for the children at risk of academic difficulties. If the baby is we identify what are the difficulties the baby is filled by the before the 2 years. 0 to 3 years is very identical for the baby's development. If we identify it within that days, it will show nice result in that. If we are not ruling that difficulties as soon as it has been, it will result in the academic based difficulties for the baby to in the learning, writing, remembering. It will all reflects in that. Next is the yearly intervention program. Yearly intervention helps to address developmental delay and can make a crucial difference in the children's life. Every child is unique. Children progress rapidly in their early years. Individual children have their strength and weakness. Their developmental progress occurs in the certain sequence, but the phase of the developments may vary. Yearly intervention, that is the techniques how we are using, it won't be same for the every children. It will all differ each to each children's. Next is the yearly intervention. You can't see in this. This is the prevention phases. In this prevention phases, we want to check the baby is having all the normal developmental or not. If the baby is having any other. So in the case identification and the yearly treatment, the baby will comes on the treatment phases. That is the yearly intervention phase. That is the indicator of any specificity is there. And the case identification and the yearly treatment. Then if the baby has been cured, that it will comes to the continuous care process for the long-term care. Next, yearly intervention techniques. In this yearly intervention techniques, we want to go on with the sensory stimulation. In this sensory stimulation, we have three main this. In this, auditory clues, visual clues, tacto-vestibular proprioception process. In this visual clues, where 10% of this will help for the baby's development. For the auditory clues, it will gives you 20% and the tacto-vestibular proprioception movement. So how the baby has been in the joint-based activities, movement-based activities, it will help to you. Next, these are the advantages of the yearly interventions. If we are giving yearly identification and the yearly intervention, which improves children's developmental, social, and educational gains. Next, reduces feelings of isolation, stress, and frustration that families may experience. If the baby is not having proper developments in their developmental in the developmental domains, the baby will isolate themselves. Due to this isolation, the parents will having the stress and the frustration because of that. Next, it will help to alleviate and reduce behavioral issues by using positive behaviors. By having this, it will help you in the positive behaviors. Next, the strategies and the interventions. Next, help children with the disabilities grow up to become productive, independent individuals. Next is reduce the future cost of special education, rehabilitation, and the healthcare needs. If you're taking care of the baby in the yearly identification, it will help in the yearly intervention. If you've given yearly intervention techniques, the baby will have nice future in that. It will help the baby to overcome the problems which they are facing in the future years. Next is here, any questions? Hello.
Thank you so much for this very nice session. If If any has any question, you can ask.
Shall I wind up the session?
I think no one have any question, ma'am.
Okay, sure.
Thank you so much all the participant for your active participate. Let me inform to all that this complete session will be available on our Business Rozgar YouTube channel. So if want to watch it again or want to share it to somebody, please do visit the Business Rozgar YouTube channel.
Thank you.
Ma'am.
Thank you. Thank you.